We all know that India is gradually becoming the diabetes capital of the world. Today, on this particular day, we should take a pledge to actively and fruitfully manage this pandemic so that many patients who develop this disease do not land up in complications and lead a good, effective, good quality of living. So to do that, we need to gear up on several aspects. One of the important challenge we usually face during management of this disease is that treatment of the elderly. The elderly patients, there are a lot of problems. The first problem is a caregiver problem. That means all those who are taking care of these patients, patient may be either alone, there is nobody to take care, patient may have to take self-care. So the problem of caregiver needs to be addressed. Second, patient may be having a lot of other comorbidities which needs to be treated simultaneously. We all know the treatment is difficult during elderly period because of the cognitive dysfunction which these patients develop. Cognitive dysfunction means that there is an ineffective brain activity. That means the brain will not function like a younger person. So there are a lot of problems while treating those patients with cognitive dysfunction. Patient may be having other diseases along with it. That also needs to be seen. We have to see the acute complication. We have to manage the acute complications in a much effective way. One of the most important thing is hypoglycemia, that is low blood sugar. These are the patients who are more prone to develop hypoglycemia, and we have to treat them, we have to tell them, we have to inform them what are the conditions when this hypoglycemia develops, and we have to give all those medications which are safe during that period. There are other diseases, patient may have sudden cardiac problem. So all these things are very difficult to treat in the elderly. On this World Diabetes Day, we should take a pledge to manage these patients in a much effective way so that we avoid the complication, at least try to prevent developing the complications which these patients develop in future and raise the cost of treatment overall. So on this World Diabetes Day, I request you all to take part in the overall management of diabetes, be it from the patient's attendant side, the patient side, or even the healthcare provider side. Thank you very much.